Hello, Miss. I will be presenting my presentation for today, which is about Mayo Clinic. Mayo Clinic is the clinic that the healthcare organization that I picked for my presentation. Uh, Mayo Clinic is a globally recognized non-profit academic medical center headquartered in Rochester, Minnesota. It was originally founded in 1864. It's globally recognized for its clinical practice and research excellence. Mayo Clinic is also a multidisciplinary healthcare organization. It offers highly specialized services like cardiology, neurology, and oncology, and many other services. Mayo Clinic is also integrated with healthcare, eh, electronic health records, and advanced medical technologies. Due to the complexity of care and uses of highly advanced medical technologies, Mayo Clinic staff needs continuous training so they can be competent with the work demand and environment. And they also have to maintain strict compliance with international healthcare standards to maintain patient safety and quality outcomes. Okay, the next one is about the training programs. There are five training programs that Mayo Clinic uses for its healthcare management. The first one is patient safety and clinical risk management training. Patient safety and clinical risk management training. This training mainly focuses on minimizing medical errors and improving patient outcomes. Through this training, the medical staff are educated on identifying potential clinical risk and also about reporting near miss incidents. Through this training, the medical staff are also trained in root cause analysis using failure mode and effects analysis method. And also this training also emphasizes communication between disciplinary teams that's working within the hospital. It also Mayo Clinic also promotes just culture environment. This just culture environment is an environment where the medical staff can uh, are encouraged to openly uh, share their errors and mistakes to their superiors so that they can share their mistakes to their superiors without the fear of being punished. This type of environment creates a safe environment for the staff and enables learning and for the staff and improve patient outcomes directly. The second training program in Mayo Clinic is infection prevention and control training. Infection prevention and control training. This training program is mainly for maintaining preventing risk of infection to the patient in the healthcare environment. This training is vital e- due to high volume of immunocompromised patient and invasive procedures that perform daily at Mayo Clinic. This training program trains educates staff on hand hygiene protocols, hand hygiene cleaning protocols, and the uses of personal protective equipment during surgeries and cleaning, and also it also teaches the staff about the sterilization of medical equipments. This way, by educating the staff on these things, this way we can the Mayo Clinic can reduce the amount of infection that's spread within the hospital, preventing healthcare associated infections to the patients. This training program also regularly updates the medical staff about infection control guidelines and outbreak management strategies, so they can stay up to date with the standards and maintain patient safety and improve quality healthcare experience for the patients. The third one is uh, health information and cybersecurity training. This training is addresses risks related to health, electronic health device and electronic health records and digital healthcare systems. This training is mainly to prevent data breaches and protect patients' personal information. This training educates the staffs on protecting patient confidentiality and also complying with the health insurance portability and accountability act, also known as HIPAA. Through this training, the medical staff learn proper data access procedures and safe handling of sensitive patient information. Through this training, the medical staff can recognize cyber security threats like ransomware attacks and also unauthorized system access. They are also encouraged to report the suspicious activity promptly to minimize the potential damage, to minimize the potential data leaks can happen before it gets before it worsens. The fourth training program is occupational health and workplace safety training. This training program is mainly for protecting the healthcare workers, the medical staff from physical, chemical, and psychological hazards. Uh, the medical staff are trained in safe patient handling techniques and ergonomic practices to avoid musculoskeletal injuries. This training program also covers exposure prevention of from hazardous substances and radiation safety. Through this training, the medical staff are also educated in incident reporting system, post-exposure exposure protocols, and also this training program also includes addresses the mental health and stress management and techniques and safe behavior, addressing the high demand workplace in Mayo Clinic, so the staff can be motivated and manage stress well in the work environment. The fifth and the final training program is emergency preparedness and disaster response training. This training ensures staff. This training is mainly about ensuring staff readiness during emergencies like fire or infection outbreak in the hospital environment or publicly. This training it also mainly educates the medical staff, the roles and responsibilities that they have during emergencies, and also very emphasize on effective communication and coordination. Through this training, the medical staff participate in regular simulations and drills like evacuation procedures and crisis management. This training also educates the medical staff to give special consideration to patient to protect vulnerable patient during emergency in all crisis. Protect vulnerable patients like patients who are old, critically ill, or immobile. Lastly, this training also uh, covers education. It educates the medical staff to coordinate with the external emergency services and public healthcare authorities during emergency. Um, Lastly, I'm going to talk about Mayo Clinic's audit process to ensure compliance within the clinic. And Mayo Clinic implements a comprehensive audit process to ensure compliance with regulatory requirements and accreditation standards and internal policies. This audit process includes regular internal audits and external inspection and accreditation reviews by recognized bodies. The recognized bodies are such as the Joint Commission and the Joint Commission and the Centers for Medicaid and Medicare Services, also known as CMS. These audit process are designed to identify risk and ensure patient safety. There are also Mayo Clinic also does three types of audits in this audit process, which is clinical audit, infection control audits, and technical audits. In clinical audit is about involving reviewing patient records and observing the care processes. The infection control audits is about evaluating the sterilization of medical equipments and uh, uh, sterilization of medical equipment, and also uh, checking the environmental cleanliness around Mayo Clinic. The third one is technical audits. Technical audit is about uh, assessing medical equipment maintenance and information security systems. When this audit process are done, these audit findings are documented and classified based on the severity. Follow-up audits are also conducted to verify the effectiveness and corrective effectiveness of the corrective actions. It sustain corrective action. This continuous auditing process ensures regulatory compliance and minimizes risk and sustain reputation for excellence in the healthcare industry for Mayo Clinic. That is all from me. That is thank you, Miss.